Hey there, future CNAs. Ready to level up your skills and confidence? This video is just the beginning. We have even more CNA practice tests and lessons waiting for you, and the best part, it's completely free. So check it out. Now let's get started.
Question 1. A 90-year-old resident tells you that his mother is coming to visit on Sunday. What is your most appropriate response? A. That is impossible. Your mother is dead. B. Okay, let's figure out how old your mother could be. C. How nice. What are you going to do when she gets here? D. Are you wishing you could see your mother? The correct answer is D. Are you wishing you could see your mother? When residents who are confused about the past, do not contradict them or try to convince them they have no such thing. Do not play along with their misunderstanding. Look for the meaning behind their words and behavior. You can say, "Tell me what your mother was like." What are your best memories? Question 2. If a resident becomes confused, you should A. Place him in his room so he won't wander. B. Put him in restraints so he won't fall. C. Help the resident recognize familiar items. D. Sit him down until you have time to assist him. The correct answer is C. Help the resident recognize familiar items. When a resident seems confused, start by offering basic information. Hello, Mr. Roberts, I'm Sally, your nurse aide. Do you remember me? From there, offer other ways to help him regain his sense of time and place. It's Tuesday, August 26th. You had chicken for lunch and watched the movie. Returning the resident to his room to look at familiar objects and photos can also be helpful. Always remain calm and friendly. Question 3. A resident with Alzheimer's disease tells the nurse aide that she smells smoke. The nurse aide should A. Put the patient to bed because she is clearly tired. B. Tell her that no one is allowed to smoke in the building. C. Reassure the patient that there is no fire. D. Look around for a fire. The correct answer is D. Look around for a fire. Often the first symptom of Alzheimer's disease is a loss of short-term memory. The client can still recall events and information about the past until the disease progresses to complete loss of brain function. Depending on the stage of Alzheimer's, a client could certainly detect the smell of a fire. Question 4. Some patients may exhibit some false beliefs not supported by facts or reality. This is known as A. Deliberation, B. Digression, C. Duration, D. Delusion. The correct answer is D. Delusion. Delusions are false beliefs that involve a misinterpretation of experiences. A person may believe that they are being followed, tricked, or spied on. They may also be convinced that songs or books contain special information meant for them. Attempts to show the person that their belief is wrong or irrational are not accepted by the person. Question 5. A resident with dementia has wandered to another unit. What should the nurse aide say after finding the resident? A. Let's go. Don't you know I have work to do? B. Let's walk back together, okay? C. Do you think you're Christopher Columbus? D. How on earth did you get here? The correct answer is B. Let's walk back together, okay? 6 out of 10 patients with dementia will wander. Even in the early stages, a resident can become confused for a short time. They may be restless or trying to do former activities, such as going to work or go home. Question 6. What is an important way to help the resident feel comfortable in a long-term facility? A. Discourage visitors until the resident has settled in. B. Allow the resident to establish their own schedule. C. Bring the resident to all activities. D. Provide space for personal possessions. The correct answer is D. Provide space for personal possessions. During any change or transition, it is important to have familiar objects nearby. Special possessions, such as small pieces of furniture, blankets, photos, or mementos are important. Even personal items like soaps and shampoo can make a new environment more comfortable. If the resident has family, encourage them to visit so that the resident does not feel abandoned. Question 7. Residents with cognitive impairments often have difficulty sleeping. What can be helpful? A. Keep residents up as late as possible so they will fall asleep more quickly. B. Turn on the television and allow the residents to watch until they fall asleep on their own. C. Establish a bedtime schedule and make sure the residents go to bed within 15 minutes of that time. D. Avoid physical activity during the day because it can overstimulate the residents. The correct answer is C. Establish a bedtime schedule and make sure the residents go to bed within 15 minutes of that time. Confusion and other symptoms can become exaggerated with fatigue. Causes of sleep problems for all residents can include the natural aging process, medication side effects, pain, and nightly urination. For residents with dementia, there is also a disrupted circadian rhythm, as well as fewer deep sleep cycles. Establishing a bedtime routine can reset the internal clock and make it easier for residents to fall asleep. Increasing physical activity during the day can improve the quality of sleep. Question 8. Which of the following can be a cause of intellectual disability? A. Down syndrome. B. Childhood illness. C. Birth complications. D. All of the above. The correct answer is D. All of the above. Intellectual disability, ID, is a below normal intelligence and ability to perform basic tasks. ID can be caused by something that happens before birth, such as exposure to alcohol or drugs, or an infection. An example of a chromosomal disorder is Down syndrome. ID can be caused by an inherited condition such as Tay-Sachs disease or PKU. Problems with the birth, such as oxygen deprivation or premature delivery, are 2 more reasons. Even infections such as meningitis or whooping cough can result in ID. Question 9. The end of the day can bring a common behavior for residents with dementia, called A. Sundown syndrome. B. Overstimulation fatigue. C. Depressive disorder. D. Evening paranoia. The correct answer is A. Sundown syndrome. Caregivers can notice a big change in late afternoon or evening with clients who have dementia. Fading daylight seems to trigger confusion and agitation. It is also connected to hunger, poor vision, and less natural light. Take time to recognize the response of each resident who displays different behaviors. Does the twilight seem to cause confusion? Are lamps or other lights on? Could the residents be hungry? Does poor vision make it difficult to see? Question 10. All of the following are clues to aggressive behavior, except A. Pacing. B. Clenched jaw. C. Rocking. D. Depressed mood. The correct answer is D. Depressed mood. Knowing the signs of aggressive behavior can help you prevent a situation from escalating. An aggressive episode can develop unexpectedly. If the client has a clenched jaw or fist, or suddenly begins to pace or rock, act quickly. Assess the situation to find a possible cause. Is the client in pain, tired or hungry, overstimulated, confused? Use a calm manner to deal with the client. Eliminate distractions and try to focus on a new activity. Question 11. While the nurse aide tries to dress a resident who is confused, the resident keeps trying to grab a hairbrush. The nurse aide should blank. A. Try to dress the resident more quickly. B. Give the resident the hairbrush to hold. C. Restrain the resident's hand. D. Put the hairbrush away and out of sight. The correct answer is B. Give the resident the hairbrush to hold. Offering a resident something to hold while performing a task can make the resident feel secure and allow the nurse aide to proceed more easily. For example, let them hold a washcloth during a bed bath. If they have a favorite small object, that can also be a good source of comfort. Question 12. Which of the following is not true of dementia? A. People with dementia are often frightened and anxious. B. Grooming is difficult for patients with dementia. C. People with dementia act uncooperative in order to be spiteful. D. Patients can have vivid hallucinations. The correct answer is C. People with dementia act uncooperative in order to be spiteful. As dementia progresses, a client can exhibit any of the 4 A's of agitation, anxiety, anger, or aggression. These behaviors are not intentional, but signs of the disease. Remain calm and reassuring during these episodes. Redirecting the client is often a good way to end the behavior. Question 13. In a reality orientation program, you would do all of the following, except A. Ask them to identify the smells of their meal. B. Show them the weather outside their window. C. Ask the resident about their childhood. D. Tell them the date and time each morning. The correct answer is C. Ask the resident about their childhood. Reality orientation is a formal program that involves repeating information to help residents understand their surroundings. To keep a resident oriented, their name is used frequently. Information such as date and time are reinforced with calendars and clocks. Show residents the weather and ask them to identify smells and tastes. Question 14. When preparing to give peri-care to an incontinent female resident with dementia, the CNA knows A. The resident may become tearful. B. The resident may feel sexually assaulted. C. The resident may become combative. D. All of the above. The correct answer is D. All of the above. Even under the best situations, giving peri-care can be awkward or embarrassing for a resident. For a resident with dementia, cleaning the genital area can cause various reactions. If the resident feels threatened or fearful, they may strike back. If they have a history of unwanted sexual actions, they may cry or complain of being assaulted. Always tell the resident what you are going to do and why. Describe each step before you do it. Speak in a calm manner. Question 15. A client with dementia has developed a fear of taking a shower. What can a nurse aide do? A. Remind the client of the importance of being clean. B. Ask the client's family to convince the client. C. Give a bed bath and try a shower on another day. D. Offer a reward if the client takes a shower. The correct answer is C. Give a bed bath and try a shower on another day. A shower or bath can become a frightening experience for a client with dementia. Be patient and plan ahead. Gather everything needed and make sure the room is warm. In a gentle voice, tell the client what is going to happen throughout the process. Encourage the client to do as much as possible. Don't rush and never leave the client alone. If the client refuses to shower, give a bed bath and try a shower another day. Question 16. A confused resident tells you there is a monster in the closet. The nurse aide should A. Tell the resident there are no such things as monsters. B. Pretend to kill the monster in the closet. C. Tell the resident you will take the monster home with you. D. Open the closet and show the resident nothing is there. The correct answer is D. Open the closet and show the resident nothing is there. If a client is confused, do not play along. This only adds to the client's fear if you support the confusion or hallucination. Sensible explanations will not be helpful because the client absolutely believes the fantasy. The best approach is to calmly address the situation directly. Accompany the client to the closet, reinforcing reality. Remain with the client, reminding them of their surroundings. Question 17. Which one of these behaviors is not a signal of possible combativeness? A. Clenched mouth and teeth. B. Saying, "I am angry." C. Fists in a ball. D. Rapid eye movement. The correct answer is B. Saying, I am angry. Nonverbal signs can tell you more about a person's mood than their words. Nonverbal cues often come from instinct. Observe the signals that tell you a person is angry and ready to strike. If words and behavior do not match, always believe the behaviors or actions. Question 18. A resident with Alzheimer's disease has a baby doll that she carries with her and cares for. When she misplaces the doll, she begins to cry. What should the nurse aide do? A. Quickly find a new doll to replace the lost one. B. Tell the resident that it was only a doll. C. Comfort the resident as if the doll were real. D. Allow the resident to cry until she stops. The correct answer is C. Comfort the resident as if the doll were real. Dolls therapy can be useful for people with Alzheimer's disease. Studies show that dolls can calm and soothe residents, as well as decrease wandering. A doll can also improve speech and communication. Because the doll is real to the resident, the loss is treated accordingly. After a short time, a new doll can be introduced to the resident. It is important to note that males can enjoy dolls too. Question 19. Reality orientation should include A. Calling the resident by his name. B. Using nicknames like Granny. C. Talking about your interests. D. Telling imaginative stories to the resident. The correct answer is A. Calling the resident by his name. Reality orientation involves repeating information to help clients understand their surroundings. To keep a client oriented, their name is used frequently. Information such as date and time are reinforced with calendars and clocks. Question 20. The primary reason for combative behavior in a resident is A. Confusion. B. Resentment. C. Stubbornness. D. Hunger. The correct answer is A. Confusion. The most common cause for combative behavior in clients with dementia is confusion about their care. Because of memory loss, clients become confused when staff members try to help them. Clients may not recognize their caregivers or may not want to do what the caregiver is telling them, such as getting up, eating, or taking a shower. The client's automatic reaction will be to say no and push, hit, or kick. Always allow plenty of time when dealing with the clients. Speak softly and explain what is happening. Don't argue. Remain calm and be prepared to try again in a few minutes.
Thank you for watching this video, and we hope it was helpful. Click the link right here to start your free 3-day trial to CNA Premium, which has over 1,000 practice questions that will help you pass your CNA exam on your first try.